Hello Pasangala, Vanakkam and welcome. Nanda unga master teacher Nivetha, making bio learning very simplified. We have 𝑖𝑣𝒂𝒏𝒏𝒆𝒍𝒔 Instant Vedantu Scholarship Admission Test 2024 in offline centers near you. Chennai, Coimbatore, Tiruchi, Madurai, 4 centers lume nammala offline courses they have started with a very full swing. Okay, so 70% varaikum ungalku scholarship kedaikum. Adu matrum illama you can get a free one-to-one counseling with our experts, and you also get 2 times better scholarship when you write this exam offline pasangla. So why are you guys still waiting? Go get yourself registered. The link is given in the description below. Okay, so ipa nama romba mukkiyamaana vishayam paaka porom inniki indha chapter la enna paaka poromna reproductive health. Okay, unga NEET exam ku kandipa pasangla na adichu solren or 2 la irundhu 3 question kekkalam. சரி 3 question கூட விடுங்க 2 question ஷார்ட்டா கேட்கலாம் 8 marks, which is not a joke. Okay, so reproductive health comes for 8 marks. So in the chapter la என்னெல்லாம் முக்கியமா இருக்கு பசங்களா, what are the topics which are there in this chapter? You have birth control methods, அதுதான் first important ஆன topic. அதுக்கு அடுத்தது you have medical termination of pregnancy, then you have sexually transmitted diseases, then you have assisted reproductive technology. ரொம்ப குட்டி chapter தான், ரொம்ப சீக்கிரம் முடிச்சிடலாம், but very important questions come from it. So என்னென்ன chapterல இருந்து ரொம்ப முக்கியமான questions கேட்கலாம்னா, you have this birth control methods, okay, and you have ARTs, assisted reproductive technology. These are the 2 most important topics from which you can expect a lot of questions pasangla. So let's try to decode it very quickly. What is reproductive health? Reproductive health refers to not only physical well-being but also emotional, social and behavioral well-being. It is important for the development of a country to have a reproductively healthy society. Kandipa. Correct? Reproductive health is very important pasangla. Okay, now what are the problems, especially in a country like India? What are the problems that we are facing related to reproductive health? Rombo general ana topic tha. Okay, increasing population is ever increasing. Sexually transmitted disease, AIDS, syphilis, gonorrhea, herpes, அந்த மாதிரி எக்கச்சக்கமான diseases இருக்கு. Female feticides. What is female feticide? அது ஒரு பெண் குழந்தையா இருந்தா வயிற்றிலேயே அந்த குழந்தையை கொல்றதுக்கான ஒரு attempt, that is what we call it as female feticide. Infant care and maternal death. இந்த 4 ப்ராப்ளம் தான் related to reproductive health பசங்களா. ரொம்ப முக்கியமான விஷயம். What is RCH? Okay, so இதை overcome பண்றதுக்கு நம்மளோட government of India has come up with reproductive and child health care programs பசங்களா. Family planning programs, awareness about reproductive health, sex education. So இதெல்லாமே கொண்டு வந்திருக்காங்க. That's very important to understand. What is RCH? Reproductive Child and Healthcare Program are run to improve the reproductive health of a society. Okay, 1951 la family planning program kondu vandanga to control the human population. Reproduction related awareness is created using print and digital media. Ippala sollave venda 10-15 வருஷத்துக்கு முன்னாடி ரொம்ப கஷ்டமா இருந்துச்சு. Now everything is through all our social media, right? Yes. Awareness about எதை பத்தின awareness வந்து create பண்ணணும்? Birth control measures. Pregnancy எப்படி avoid பண்றது? Okay, pre and postnatal care. ஒரு pregnant ஆன அப்புறம் எப்படி நம்மள பார்த்துக்கணும்? pregnancy முடிஞ்சு குழந்தை பிறந்த அப்புறம் எப்படி அந்த குழந்தையை பார்த்துக்கணும், எப்படி அந்த அம்மாவை பார்த்துக்கணும், அதெல்லாம் தான் postnatal care ன்னு சொல்றோம். Educating people about sexual organs and hygiene, safe sexual practices. STDs has helped people leading healthy reproductive life. Okay, yes. Awareness regarding menstrual process. நிறைய பெண் குழந்தைங்களுக்கு menstrual process பத்தின awareness இருக்காது. Okay, and reproduction process has helped in eradicating social evils. நிறைய myths இருக்கு, அத பத்தி நாம இங்க பேச வேண்டாம். Okay, there are so many myths related to menstrual cycle, periods, நிறைய myths இருக்கு. Where a female was blamed for giving birth to a female child and other related issues. Let's not talk more about that. Okay, let's get into the session. Yes, amniocentesis. இது ரொம்ப முக்கியமான விஷயம். நிறைய வாட்டி கேட்டிருக்காங்க உங்க நீட் எக்ஸாம்ல. உங்க fetus இருக்குல்ல பசங்களா, the fetus is surrounded by a fluid called amniotic fluid பசங்களா. so இந்த amniotic fluidல ரொம்ப ரொம்ப முக்கியமான விஷயம், it is used to determine the genetic disorder. so என்ன பண்ணுவாங்கன்னா, they take the amniotic fluid பசங்களா, and the amniotic fluidல சில fetal cells இருக்கும், there will be certain fetal cells, okay. from this fetal cell they will isolate the chromosomes, okay, and the chromosome isolate பண்ணி we can actually determine the sex of the baby, whether the baby is a male or a female, okay. any genetic disorder, Down syndrome, Klinefelter syndrome, hemophilia, அந்த மாதிரி ஏதாச்சும் genetic disorder இருக்கான்னு அது குழந்தையா இருக்கும்போதே we can actually find out. that is amniocentesis பசங்களா. sex determination by amniocentesis is banned in India, okay. not just by amniocentesis, and ultrasound la irundhu குழந்தை வந்து பெண் குழந்தையா ஆண் குழந்தையான்னு கண்டுபிடிக்கிறதே பேன் பண்ணப்பட்டிருக்கு. அதபடி சொல்ற டாக்டருக்கும் ஜெயில், okay. அந்த மாதிரி கேக்குற பேரண்ட்ஸ்க்கும் ஜெயில், okay. that's very very important. This is your amniocentesis, okay. Slowly they will basically take out the amniotic fluid and they try to isolate the cells, and from there they try to isolate the DNA and test it, okay. yes. population எக்கச்சக்கமா explosion ஆயிட்டே இருக்கு பசங்களா, okay. population growth in 2011 is 2%, that is 20 people per 1000 people per year. ஒரு 1000 பேருக்கும் 20 பேர் வருஷம் இன்க்ரீஸ் ஆயிட்டே வராங்க. ரொம்ப முக்கியமான ஒரு பாயிண்ட், ஓகே. causes for population explosion, அதுதான் நம்ம population explosion ன்னு சொல்றோம். increase in population, increase life expectancy and declining death rate. life expectancy வந்து அதிகமாயிட்டே இருக்கு, whereas the death rate is slowly declining. okay, then declining infant mortality rate. with free hospitals, we have government hospitals in every place, okay. so அந்த government hospitalல நல்ல கேர் எடுத்துக்கறாங்க, அதனால குழந்தைங்க இறக்குறது கம்மியா இருக்கு. அதே மாதிரி குழந்தை பிறக்கறப்போ அந்த அம்மாவோட டெத், maternal deaths குறைஞ்சிருக்கு, okay. maternal mortality rate has also decreased and increase in the number of people having reproducible age. obviously as population increases, the people in the reproducible age also increases. what are the measures to control population explosion? promoting smaller families by creating awareness, birth control measures and giving incentives, by raising the legal age of marriage, female க்கு 18 years, male க்கு 21 years increase பண்ணிருக்காங்க, legal age of marriage for male and female, okay. let's see what is contraception. what is contraception? they are designed to prevent pregnancy. என்னோட pregnancy-ய prevent பண்றதுக்காக யூஸ் பண்றாங்க. intentional prevention of consumption through the use of various devices like birth control and fertility control. இப்போ நம்ம முதல்ல பார்க்க போறது birth control, okay. so இந்த birth control ideal contraceptive எப்படிப்பா இருக்கணும்? it should be easy to use, accessible, effective, அதுக்கு ரொம்ப கம்மியான side effects இருக்கணும். these are all some of the important, very important ideal contraceptive characteristics, okay. so நிறைய methods இருக்கு, natural method, barrier method, IUDs, oral contraceptives, injectable and implants, surgical methods, okay. 6 விதமான contraception இருக்கு, natural, barrier, IUDs, oral contraceptives, then injectable implants and surgical methods, okay. we are going to discuss about each of them. this is the major chunk of the chapter பசங்களா, ரொம்ப முக்கியம். so முதல்ல வரது natural method, period assistance ன்னு சொல்றாங்க, இல்ல இது rhythm method ன்னு சொல்றாங்க. avoiding sexual intercourse during fertile period. fertile period னா என்ன? it's a period during ovulation, 10th to 17th day of menstrual cycle. you can avoid the sexual contact. that is a natural method பசங்களா. அடுத்தது lactational amenorrhea. what is lactational amenorrhea? after a mother gives birth. Okay, so அவங்க பாடியில வந்து ஹார்மோன் லெவல் வந்து ரொம்ப டிஃப்ரெண்டா இருக்கும். Okay, their levels will be totally different. So what happened? Due to lack of ovulation during intense breastfeeding, there is very less chance of fertilization. Ovulation ரொம்ப கம்மி. நிறைய பேருக்கு periods வராது up to 6 months after the child is born. Okay, so that's very important point. The last one is coitus withdrawal or coitus interruptus. The male partner completely removes just before ejaculation to prevent insemination. So மூணு மெத்தட் இருக்கு. Natural methodsல what are you have your absistence method, lactational amenorrhea and coitus interruptus. Next நம்ம பார்க்க போறது barrier method. So what is this barrier? ஒரு it is not going to allow the entry. கரெக்ட்டா அதுதான் நம்ம barrier ன்னு சொல்றோம். It blocks the entry of the sperm into the vagina and prevents conception. Conceptionனா என்ன? Pregnancy-ய prevent பண்ணும். Okay, example, disposable male and female condoms, reusable cervical caps, diaphragms and valves. Okay, contraceptive efficiency is increased by using spermicidal creams, foams and jellies. Okay, so this is how that is about your barrier methods. Okay, இப்போ நம்ம பார்க்க போறது intrauterine device, the most important thing for your exam. It's the most widely used contraceptive. It is a small T-shaped, இங்க பாருங்க, ஒரு T-shaped device which is directly introduced through the vagina in the uterus. It is done by a gynecologist. நம்ம சும்மாலாம் இத பண்ண முடியாது. ஒரு gynecologist இல்ல obstetrician கிட்ட தான் நம்ம போய் இத பண்ணணும். IUD work by suppressing motility. எதோட motility? Sperm ஓட motility, fertilizing capacity and increasing the phagocytosis of the sperm. மூணு விஷயத்தினால இந்த IUDs work ஆகும். ஒன்னு, they suppress the motility of the sperm. இன்னொன்னு, they decrease the fertilizing capacity. And one more thing, they increase the phagocytosis of the sperms. பசங்களா, ரொம்ப முக்கியமான விஷயம். Okay, yes. First, let's talk about non-medicated IUDs. IUDsல நிறைய விதம் இருக்கு. மெடிசன் இல்லாத IUD. Okay, அதை என்னன்னு சொல்றோம்னா lipase loop சொல்றோம். Lipase loop is a non-medicated IUD. It causes a sterile inflammatory response by producing a tissue injury of minor degree but sufficient enough to be spermicidal. Okay, it's going to cause a small or tissue injury மாதிரி cause பண்ணும், and that is going to act as a spermicidal effect. Okay, lipase loop இந்த மாதிரி ஒரு லூப்பை தான் நம்ம ஒரு non medicated IUD ன்னு சொல்றோம். ரொம்ப முக்கியமான விஷயம். The next one is copper releasing IUD. என்ன மேம் பண்ணோம் இந்த IUD? It simply releases copper பசங்களா. Example, multi-load 375, CU7. இந்த copper releasing IUD release small amount of copper inside the uterus that prevents the sperm from reaching the ovary. அது வந்து என்ன தடுக்கும்? என்னோட sperm வந்து ovary reach பண்ணாத மாதிரி இது வந்து தடுக்கும். That is the function of copper releasing IUD பசங்களா. ரொம்ப முக்கியமான விஷயம். Okay, then you have hormone releasing IUD. Hormone IUDs make the mucus on your cervix very thick. Okay, the mucus blocks the sperm so it can't get to the egg. The hormones in the IUD can also prevent ovulation. You have progesterone, LNG20. They are all example for hormone releasing IUD. Okay, non-medicated IUD, copper IUDs, hormone releasing IUD. These are the three important kinds of IUDs. Hormone releasing IUD ke example enna? LNG20, progesterone. Very important pasangla. Okay. Oral contraceptives. இப்போ நம்ம oral contraceptives குள்ள போலாம். Popularly known as pills. They have to be administered for 21 days starting from the 5th day of the menstrual cycle. Okay, 5th day of the menstrual cycle வந்து 21 நாள் அந்த மெடிசனை சாப்பிடணும். Okay, after that they should leave a 7-day gap. Okay, and then repeat the same course. And until you don't want to get pregnant. Okay, they prevent ovulation and inhibits. This is very important line for your NEET exam. Idu kandipa kekalam. Okay, prevents ovulation and inhibits implantation and sperm entry by thickening the cervical mucus. So enna pannom, it is going to basically thickens the cervical mucus, so the sperm doesn't enter. ரொம்ப முக்கியமான விஷயம். ஆனா நிறைய side effects இருக்கு பசங்களா. These oral contraceptives are basically a combination of hormones, progesterone and estrogen. Okay, we call it as progestogens. Okay, progestogens ன்னு சொல்லுவோம். Oral contraceptives are hormonal combination. Yes, so this is how it happens. Okay, 5வது நாள்ல இருந்து ஆரம்பிச்சி okay 21 நாள் வரைக்கும் எடுத்துக்கிட்டு okay, then you leave a 7-day gap, immediately you will get your periods. Okay, yes. Saheli, இது ரொம்ப முக்கியம். They are asked this. It's a non-steroidal oral contraceptives. Okay, so who developed this? It was CDRI Lucknow, Central Drug Research Institute Lucknow developed this Saheli. It's once a week pill. Okay, very effective with least side effects. Side effects வந்து ரொம்ப குறைவு இந்த ஒரு once a week pill Saheli la. It's non-steroidal. It's made up of 𝒕𝒐𝒓𝒆. Okay, அது ஒரு medicine, ஒரு drug. Yes. Effective. Then you have injectable and implant. Effective emergency contraceptives like your eye pill and all, it should be taken 72 hours of unprotected intercourse. Progesterone and proestrogen and progesterone. Estrogen can be injected or implanted under the skin. Inga parunga pasangala, you can implant this particular medicine in your skin. Okay, so that it keeps releasing and it's going to prevent your conception. Then terminal method, surgical method and the ultimate method. Okay, so this is usually irreversible. இத வந்து திருப்பி reverse பண்றது ரொம்ப கஷ்டம். பண்ணிருக்காங்க, effective is very less. Okay, அது வந்து reverse பண்ணி திருப்பி pregnant ஆகிறது வந்து ரொம்ப கஷ்டம். Then vasectomy, tubectomy. Vasectomy is male sterilization. Okay, vas you can remember like that. Okay, then female sterilization, a small portion of the fallopian tube. Tubectomy, you can remember like that, is tied and cut. Adhaadu tie panni cut panniruvanga. I have the picture. Okay, this is your male sterilization and this is your female sterilization. Okay, you can see. Clear pasangla? This is your NCERT picture. Vas deferens is tied and cut. Here the fallopian tube is tied and cut. Vasectomy, vas deferens. Tubectomy, the tubes, the fallopian tubes are tied and cut. Very important. இப்போ நம்ம medical termination of pregnancy போலாம். What is MTP? Okay, medical termination of pregnancy is a procedure of doing an abortion. It's literally killing a baby in the womb. Okay, it is a completely legitimate process and as well as safer during the first quarter period of pregnancy. எல்லாருக்குமே தெரியும் உங்க pregnancy வந்து 3 trimester-ல பிரிக்கப்பட்டிருக்கு. First trimester, second trimester and third trimester. இந்த first trimester-ல மொத 3 மாசங்கள்ல இந்த MTP பண்ணீங்கன்னா it's safe for the mother. Okay, abortion or medical termination of pregnancy is the expulsion of the pregnancy tissue, fetus, placenta from the womb. Okay, the maximum of the termination process is done during the first 12 weeks of pregnancy. இது ஒரு ரொம்ப முக்கியமான NEET question. Okay, this is very important. There are several times in NEET. Okay, next. MTP was made legal in 1971 but with strict conditions to avoid the misuse of female feticide. So நிறைய பேர் இதை யூஸ் பண்ணி பெண் குழந்தைகளை கொல்ல ஆரம்பிச்சிடக்கூடாதுன்றதுக்காக ரொம்ப ஸ்ட்ரிக்டான ஆக்ஷன்ஸ் வந்து கொண்டு வந்தாங்க. In 2017, the MTP Amendment Act came into force to further reduce illegal abortion and maternal mortality. According to this act, pregnancy may be terminated before 12 weeks on the advice of the registered practitioner. நீங்க சும்மாலாம் போய் இப்படிலாம் அபார்ஷன்லாம் பண்ண முடியாது. Okay, you need to get a approval from a gynecologist or a doctor. Okay, if it is done after 12 weeks of pregnancy, then you need to refer 2 doctors and it has to be terminated before 24 weeks. 24 weeks அப்புறம் நீங்க நினைச்சாலும் அந்த குழந்தையை ஒண்ணும் பண்ண முடியாது லீகலா கூட. Okay, after which it is not safe for the mother to terminate the pregnancy. அது வந்து அம்மாவோட உயிருக்கே அது வந்து ஆபத்தா போய் முடியிற சான்ஸ் அதிகமா இருக்கு. Okay, on request, abortion for any reason is legal though gestational limits still apply. Gestational limits na 12 week, 15 week and the mari. Okay, save life. Abortion is legal when necessary to save the life of the women. Physical health, mental health ரொம்ப ரொம்ப முக்கியம். ஒரு அம்மாக்கு அந்த குழந்தை வேணும்னா மட்டும்தான் வேண்டாம். வேண்டாட்டி குழந்தை தேவையில்லை because the mother is the one who should decide. Okay, it's not anybody else. So physical health, abortion is legal when pregnancy risks significant. Okay, அந்த குழந்தையால அந்த அம்மாக்கு ரொம்ப பாதிப்பு இருக்கு. அந்த அம்மா வந்து சாவர நிலைமைக்கு போலாம். அதான் fetal ன்னு சொல்லிருக்காங்க. Okay, injury to the women. Mental health, abortion is legal when pregnancy puts the women's mental and emotional health at risk. Okay, so in India abortion is legal pasangla. Okay, so the function of copper ions in copper releasing IUDs ippana padichom. They inhibit gametogenesis. Okay, they inhibit ovulation, they suppress the sperm motility and fertilizing capacity of sperm. All of the above. Tell me the answer pasangla. It is option C. NEET 2017 la இந்த கேள்வி கேட்கப்பட்டிருக்கு. Next question. Which of the following is a hormone releasing IUD? இப்பதான் படிச்சோம். Lipase loop, okay, multi-load 375, CU7, LNG20. The right answer is LNG20 பசங்களா. இந்த மாதிரியான question ரொம்ப சிம்பிளான questions கேட்கலாம். Medical termination of pregnancy is considered safe up to how many weeks of pregnancy? எத்தனை வாரம் வரைக்கும் அது சேஃபா கன்சிடர் பண்றோம்? Up to 12 weeks. This was asked in the year 2011. Okay, இப்போ நம்ம STIs போலாம். Sexually transmitted infection. Infections transmitted to healthy female or males through sexual intercourse with infected people is what we call it as STI. Reproductive tract infection, venereal disease ன்னு சொல்லி ரெண்டு விதம் இருக்கு. Every STI is not sexually transmitted. You have AIDS. AIDS is also transmitted via blood. Okay, it's not like STI should be transmitted via this only. They can spread through non-sexual contact also. Non-contact modes include transmission of contaminated blood, இப்பதான் நான் சொன்னேன், tissue, breastfeeding, sharing of syringes, etc. STDs like AIDS can be passed from the mother to her child during birth. ஒரு அம்மாக்கு வந்து AIDS இருந்து அதை வந்து டயக்னைஸ் பண்ணாம விட்டுட்டாங்கன்னா அந்த ஒரு டிசீஸ் வந்து அந்த குழந்தைக்கும் பரவலாம். Right? So that is also there. Keep that in mind. Yeah. நிறைய விதமான STIs இருக்கு. Bacterial and viral. Bacterial gonorrhea, syphilis, chlamydiasis இருக்கு. Viral herpes, warts, HBV and HIV இருக்கு. Okay? So these are some of the STDs and STIs. So you have bacteria, Neisseria gonorrhoeae, mycoplasma, எக்கச்சக்கமா இருக்கு, human papilloma virus, hepatitis B virus, hepatitis C virus. Okay, and you also have protozoa, it causes vaginal-asis. Okay, extra information da. Neisseria gonorrhoeae, you have a syphilis. Okay, syphilis or the symptoms you just have to understand. So it causes pus-like discharge, swelling, discharge from the vagina, heavier periods, painful sensation, frequent urination, sore throat, pain during sexual intercourse, fever. Treatment using antibiotics. Okay, Treponema pallidum. Okay, that is causing your syphilis. Yeah, HIV patti kandipa pesiyagum, right? HIV is human immunovirus which transmits AIDS. Okay, so AIDS spreads through using non-sterile syringes during pregnancy, during breastfeeding, blood transfusion, okay, organ transplant. 80% is due to unprotected sex. HIV is not transmitted via sharing their utensils, sharing food, okay, by insect bites, cloths, toilet. It's not spread in that way. Okay, remember that. Early symptoms of AIDS: fever, muscle and joint pain, chills, headache, sore throat, night sweat, red rashes and mouth sores, tiredness, swollen lymph gland, weakness, weight loss, diarrhea. So இந்த AIDS வந்து ரெண்டு சாப்டர்ல படிக்கிறீங்க. ஒன்னு வந்து இங்க, இன்னொன்னு வந்து human health and disease. So it's quite important. Okay, World AIDS Day is celebrated at December 1st. Okay, blurred vision, late symptoms ஒரு ஸ்டேஜுக்கு அப்புறம் அந்த window period கழிச்சு, okay, persistent or chronic diarrhea, dry cough, fever of about 37 degree, okay, night sweats, permanent tiredness, shortness of breath, swollen glands lasting for week, weight loss, white spots on the tongue or mouth. Okay, symptoms. Treatment: There is no specific treatment, okay, because it has almost conquered my immune system. With proper diagnosis, treatment and support, one can fight it and live a relatively healthy and happy life. Okay, you can actually lead a very healthy and happy life. Okay, adhe or later stages la window period தாண்டி நீங்க போய் கண்டுபிடிச்சீங்கன்னா ரொம்ப கஷ்டம். So what is the drugs? Anti-retroviral therapy. இது வந்து human health and disease லியும் நான் சொல்லியிருந்தேன். We call it as anti-retroviral therapy பசங்களா. ரொம்ப முக்கியமான விஷயம். Prevention is always better than cure. Believe it. Okay? Yes. Prevention of STIs, use condoms, avoid sharing towels, wash, get vaccination, get tested. Okay, if you have a problem with drug or alcohol abuse, please get help. Consider that not having sex is the only sure way to prevent STDs. Infertility. ரொம்ப முக்கியமான விஷயம். Okay, infertility can be defined as the inability to conceive after more than 1 year without the usage of contraception. 10-14% of the Indian population is suffering from infertility. இப்போ அது ஒரு கொடிய ஒரு பிரச்சனை ஆயிட்டு இருக்கு, ரொம்ப சீரியஸான பிரச்சனை ஆயிட்டு இருக்கு. Okay, men and women both could be infertile. Let's be honest. It's not that always a woman will have problem. A man can also have a problem. Okay, yes. In males, you have erectile dysfunction, sperm count disorder, oligospermia, azoospermia, இந்த மாதிரி நிறைய விஷயம் இருக்கு. Age is very important. Aged males have lesser sperm count, structural abnormality, motility of the sperm, the shape of the sperm, everything matters a lot. Okay, in females, inability of the ovary to produce egg, that is PCOS, polycystic ovarian syndrome, quality of the uterine lining, endometriosis, nariya perukku irukum, structure of the fallopian tube, and the fallopian tube la edach blockage irukum, advanced maternal age, okay, nariya oru 35 36 they get married, okay, adanal they can become infertile, chances are more. Okay, so these are the reasons you can see. Okay, 1 of 3 families struggle with infertility. 3 in 10 women struggle with infertility. There are a lot of things. Women la it is PCOS, okay, and you have endometriosis. ரொம்ப முக்கியம். இப்போ சின்ன குழந்தைங்களுக்கு பசங்களா 18 19 20 அந்த ஏஜ்ல நிறைய பேருக்கு PCOS PCOD இருக்கு, obesity, lifestyle, they are the major reasons for infertility. Okay, now let's talk about ART, assisted reproductive technology. It's a technology used to attain pregnancy through the usage of various procedures. Okay, avangala naturally pregnant aga mudiyala, adanal we are trying to use some artificial method to get them pregnant. That is what we call it as ARTs. Okay, what are the different types of ART? IVF, in vitro fertilization. All these abbreviations are very important. Adukku you have IUI, intrauterine insemination. Adukku you have intrafallopian transfer, IFT. Next you have ICSI, intracytoplasmic sperm injection. This எல்லாத்தையும் quick ஒண்ணொண்ணா பார்த்திரலாம். முதல்ல IVF. What are the most common forms of ART? Fertilization occurs outside the body. So enna pandrangana, they are collecting good quality ovum, they are collecting good quality sperms, and they do fertilization in the laboratory. Adanala da adha vandu nama in vitro nu solrom. That is why we call it as in vitro. And what is it resulting in? It results in the formation of zygote. Now the zygote develops into embryo. Okay, now this embryo is again implanted in the uterus. Okay, so IVF குழந்தைங்க less intelligent இருக்குமா man, அப்படியெல்லாம் ஒண்ணுமே கிடையாது பசங்க. They are as healthy as normal babies. There is nothing wrong in IVF. Okay, that is ultimate அவங்களுக்கு கிடைச்ச ஒரு chance அது. Okay, so here you can see how the eggs are aspirated. Okay, then you have the sperm that is happening, sperm preparation nadakudhu, you have this fertilization that's happening, then you have the embryo formation, and this embryo is implanted via cannula into the uterus. அதுதான் நம்ம embryo transfer ன்னு சொல்றோம். Egg pickup, okay, sperm preparation, egg fertilization, then you have embryo transfer. This is very important. Usually in the IVF babies are twins ah da irupanga. There will be 2 to 3 babies there. Why? ஒரு பேபிக்கான survival rate ரொம்ப கம்மி. அதனால they tend to implant 2 to 3. Okay, that's very important. Next, gamete intrafallopian transfer. Transfer of sperm and eggs into the fallopian tube of a woman where fertilization takes place. இது intrafallopian, இது in vitro கிடையாது. Okay, gamete intrafallopian transfer. I am transporting the gametes into the fallopian tube where the fertilization happens. I think all of you know it is the ampullary region where fertilization occurs. Okay, so that's very important. Next, you have ZIFT. ZIFT na enna pasangala? Zygote intrafallopian transfer. Okay, the ovum and sperm are undergoing fertilization in the laboratory. The zygote is formed, they develop into embryo, they transfer the embryo into the fallopian tube. Instead of transferring the embryo into the uterus, they transfer it into the fallopian tube, where the further development of the embryo takes place. ரொம்ப important ஆன விஷயம். That is your ZIFT. Okay, here you can see the eggs are aspirated from the ovary. They are placed in the prepared semen sample. Fertilization நடக்கும். The fertilized embryo or zygote are transferred into the fallopian tube. They are transported there. Okay, so இப்போ என்னென்ன படிச்சிருக்கோம் நாம? IVF, okay, GIFT, அதுக்கப்புறம் ZIFT. IVF na enna pasangala? In vitro fertilization. GIFT na enna? Gamete intrafallopian transfer. ZIFT na enna? Zygote intrafallopian transfer. ரொம்ப முக்கியமான விஷயம். Yes. Next you have ICSI, intracytoplasmic sperm injection, used for couples when the male is infertile and the male la edho or prachana irukna, we will use this. Also used for those with failed IVF attempts or even an older couple. A single sperm is introduced into a mature egg, thus fertilizing the ovum to produce zygote. So compulsory 100% inga vandu zygote form ஆகும். அதுதான் நம்ம ICSI ன்னு சொல்றோம். இங்க பாருங்க, this is ICSI. You are introducing the sperm directly into the egg cytoplasm. Okay, and that is going to assure 100% fertilization. So இது வந்து நம்ம micro injection ன்னு கூட சொல்றோம். We call it as micro injection also. Remember that. அடுத்தது artificial insemination, deliberate introduction of sperm into the female reproductive tract to achieve pregnancy without sexual intercourse. Okay, you have intrauterine insemination, intracervical, intratubal. Intrauterine na the semen is introduced into the uterus. Intracervical na it is introduced into the cervix. Intratubal na it is introduced into the fallopian tube. That's very important to understand. You can see it is directly introduced into the fallopian tube. I hope it is clear. Okay, next, surrogacy. இது நிறைய பேர் இப்போ கேள்விப்பட்டிருப்பீங்க, கரெக்ட்டா? Process where another woman bears a baby of the couple facing infertility issues. Okay, so இவங்க தான் உண்மையான mother, உண்மையான father. Okay, they will collect the sperm and egg, they will fertilize and they will transfer the embryo into a surrogate mother. Formation of the baby can take place either by the fertilization of egg and sperm from the couple or from the donor of the egg and the sperm. Okay, ரொம்ப முக்கியமான விஷயம். This is not there in your syllabus, but you guys need to know. Okay, so that's all about a very small lesson. Okay, I have few questions. Let's see how it goes. In case of a couple where the male is having a very low sperm count, which technique will be suitable for fertilization? Sperm count வந்து ரொம்ப கம்மியா இருக்கு, எந்த டெக்னிக் வந்து யூஸ் ஆகும்? Artificial insemination. Okay, that's the reason. The transfer of ovum collected from a donor into a fallopian tube, என்ன சொல்வாங்க அத? It is called gamete intrafallopian transfer, GIFT. இந்த மாதிரின क्वेश्चन கண்டிப்பா கேட்கலாம் உங்க எக்ஸாம்ல. சோ ரொம்ப முக்கியமான விஷயம் எது பசங்களா? இந்த சாப்டர்ல you have birth control methods and ARTs, assisted reproductive technology. These two are very important, and if you guys want this PDF, you can download it from the link that is given in the description below. Thank you so much. This was a very short quick lesson which is going to get you 8 marks in less than 35 minutes. Okay, so do stay tuned for more bio learning. Like, share share and subscribe to our channel. Thank you so much.